Have you ever noticed your finger curling in? No matter how hard you try, you can't fully straighten them. It might not be just stiffness, it could be dupuytren's contracture. This condition sneaks up slowly, making it harder to grip things, shake hands, or even open your palm. But don't worry, today I will explain everything step by step so you can understand what's happening and what to do about it. And one more thing, make sure to watch till the end because I will share some important tips that might will help. So what is Dupuytren's contracture? It's a condition where the tissue under the skin of your palm thickens over the time. This creates a tight cord that pulls your fingers inward, making them stiff and hard to move. It usually affects the ring and little fingers first. It develops slowly, sometimes over years. It's not always painful, but it limits movement in your hand. If you have noticed tightness in your palm or difficulty straightening your fingers, keep watching. You might be in the early stage. This condition develops in the three stages. Let's go through them one by one. Stage 1. You will feel a small lump or a residue in your palm. It may feel tight but won't cause pain. No movement restriction yet. Stage 2. The fibrous cord thickens and starts pulling your fingers inward. You might notice difficulty straightening your fingers at the metacarpophalangeal joint, knuckle areas. This is when gripping objects become harder. Stage 3. The condition gets worse, affecting both the MC pinnacle and PIP middle finger joint. Your fingers are now permanently bent and can't fully straighten. This makes everyday activities like holding a pen, shaking hands, or opening a jar really difficult. If you are in stage 1, early treatment might help to prevent worsening it. If you are in stage 2 or 3, you might need medical intervention. So now causes and risk factors. You might be wondering why does this happen? I am sure. Well, the exact cause isn't fully understood, but here are some known risk factors. Genetics. If your parents had it, you might too. Age and gender. More common in men over 40. Diabetes and smoking increase the risk. Moreover, one more thing, it is more common in the men. Yeah, I already told about that. Alcohol and hand trauma. Long-term damage might trigger it. This means if you are at risk, you should pay close attention to early symptoms. So how to treat Dupuytren's contracture plus icons of different treatments?
So, what can you do if you have this condition? In early stages like 1 and 2, stretching and physiotherapy will gonna help you keep the fingers flexible in this case. And the steroid injections also work. It can slow down the progression. But if you are in the advanced stage like the 3, collagenase injections, it will break down the thick tissues. And surgery. If your fingers are severely bent, a doctor might remove the thickened tissues. Warning. If ignored for too long, surgery might be the only option. So please